I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning. Welcome to the March 11th, 2024 Shawnee County Commission work session. My name is Kevin Cook. I serve as the chair this year. Joining me today is Commissioner Bill Rippon. Commissioner Aaron Mays is out for the day. This is a work session, and our first presentation is from the county appraiser, Mr. Steve Bauman. So you're up.
Morning, Commissioners. Steve Bauman, Shawnee County Appraiser. And this is our 2024 real estate change of value notice presentation. And we'll just get started. In the beginning, the Kansas Constitution instructed the legislature to provide a uniform and equal basis for valuation and rate of taxation. So the appraiser's office was created and is directed by Kansas statute. Almost every aspect of our office is driven by statute and overseen by our oversight agency, the Property Valuation Division of the Department of Revenue. These are some of the more important statutes that direct our offices. We'll start off with 1430, 19-1430. That's my position, is appointed every 4 years. And 1412A in the powers and duties statute, it determines that our evaluation date is as of January 1st. 1401 establishes Property Valuation Division as our oversight agency. 501 indicates that all property must be appraised at fair market value. Some exceptions for agricultural. And then 503A provides that definition of market value, which the amount in terms of money that a well-informed buyer is willing to pay, a well-informed seller in an open and competitive market, assuming no undue compulsion. It's basically what a property would sell for a realtor on the open market. And then 505 is the uniform standards of professional appraisal practice, indicating that we have to follow that, and that USPAP was adopted by Congress in 1989 as a result of the failed savings and loan institution in order to promote a high level of public trust in the appraisal practice. Then 1460 is the reason I'm here today. Valuation notices must be mailed out by March 1st. And then finally, 1448 and 2005, both are the establishing the appeal process. The 1448 is the value notice process, and then the 2005 is the payment under protest option. We'll talk about that towards the end of the presentation. We are held to the highest standards of accuracy and compliance by our Property Valuation Division. They review most all of our processes, and the results are measured through procedural and statistical compliance. Part of that is the statistical compliance, and that is the median ratio that we are measured by. So a median ratio over 100 would indicate our appraised values are generally lower than the sale price. A median ratio over 100 would indicate that our values are generally over the sale price. So the sales ratio study uses properties that have sold after our valuation date and compares them to our January 1st value. So we don't know that they sold in advance. They come in after we set our values. Then our compliance rating for the latest 2022 ratio study, residential median ratio was at 90.1, and the commercial ratio was at 97.2. For the residential median ratio at 90.1, that is at the low end of acceptable. It is an indication that our values have been conservative and that the market's continuing to appreciate after we appraise the property. Year over year, our office has maintained near perfect compliance for substantial compliance, which is overall rating. We employ a mass appraisal technique, which is valuing the universe of properties as of a specified date using standardized procedures with testing. Models are developed for each market area using sales data, cost appreciation figures, and income and expense information to reflect what's occurring in the market. Using property characteristics in this process allows for the extracting of important factors that allow us to make adjustments between the subject property and its comparable properties. We build appraisal models to assist in the valuation of all property, but each property is appraised based on its own unique property characteristics. We are required to inspect property at least once every 6 years. However, we're out there a little more often, most of the time for things like permits and sales information. We track, identify, and list every permit that's issued, and for every property sale that occurs, every market arm's length transaction, we're out on site doing a full 360 review, exterior. While we measure and inspect every property, we don't go inside every home, so therefore we have to assume that the inside is similar in quality and condition to the exterior of the home. For the most part, that's the case, but there are exceptions. Yes, sir.
Steve, when you go to do an appraisal of a home, are we allowed to walk around the yard and to measure and take pictures? Is that all part of what we can do? And
We are. That's a statutory requirement that we do that. However, if we're asked not to, we will note it on the property and we won't go on site. We'll estimate from this street.
I sometimes notice on some social media platforms that they talk about, well, there's somebody from the county out walking around my house, and why are they there? They shouldn't be there, and all this and that. So I just wanted to make that clear. We do have the right to walk around there and look at things and take pictures.
Yes, and all of our appraisers have badges with them, visible, and they generally drive a county tag vehicle. So we're responsible for appraising over 76,700 parcels of real estate annually with an effective date of January 1st. Again, that value that we look to obtain is what it should be able to sell for in the open and competitive market. The appraiser's office was not established to generate tax revenue, but to assure the fair distribution of the total tax base. Our market has seen significant appreciation over the last several years. This year appears to be getting somewhat back to maybe normal appreciation. Wouldn't necessarily call it a normal market, but normal appreciation. This is the average residential sale prices and compared to the average appraised value for each of those over the past 6 years. So the sale prices have been coming in higher than what the appraised values are, indicating that our appraised values are conservative. Our increases have been due in part to very low inventory of available homes on the market. This year we finished with about a month's worth of supply. It's up over last year, which is good, but typically for a balanced market, it's 4 to 6 months. So we are still significantly low, which is helping prop up the appreciation rates. And you can see that we've been below that for several years. And this chart shows the total number of sales by year. 3,502 sales last year, significantly lower than the prior years. In addition, new home permits are not increasing, contributing to supply issues. We had 180 this year, 183 last year. Both of those years are down from the prior two. Our mortgage rates spiked up last year, remain up this year. And it's tempering the amount of appreciation that we're seeing, bringing us back to a normal appreciation market. And these are our mortgage rates since 1971. The 6.5% interest rate, 6.67% interest rate is getting closer to the median rate of that time frame of 7.4, but we're still not there yet. Overall, our commercial appraised values increased 2.62% this year. Residential market increased 5.5% this year. Total overall value increase of 4.85%, including new construction. So it's significantly lower. Last year, I think our total increase was 13.8. I think we'll get there on a couple slides down the road. So far, we've added about $183 million in new construction. And then, yeah, so last year we had an total appraised value of 12.83%, 12.12 the year before that. This year it's 4.85. If you look at the 2 years, or past the prior 2 years, you'll see that our increases were in the 4 range. So that's typically what we had seen prior to what you'd call the COVID years. A survey of the surrounding counties show their median increase. You can see that Shawnee County's there with 5.5. All of our surrounding counties are very similar. Johnson County to the east of us is 10. Franklin's 10. Johnson's 7.38, so that's a little lower than I would expect. Miami's 9. Wyandott's 10. Here is our total appraised value broken out by class. 68% of our total appraised value is residential classification. 13% makes up commercial, and 16% is exempt property. We also have the others: vacant ground 1%, farmland sites 2%. So when we get to the assessed value by class, residential is still holding 68% of that, and commercial now makes up 28%. Exempt left us because it doesn't have an assessed value. There's no assessment rate, no taxes with exempt property. So our residential classification property is assessed at 11.5%. Commercial is more than double that at 25% assessment rate.
Steve, if I was to look at this, are you really telling me that only 1% of the 76,000 parcels in Shawnee County are agricultural?
I'm going to tell you that 1% of our total appraised value is agricultural.
What's the difference in my question to your answer?
Well, okay, so agricultural use value or land is appraised based on its use value, not market value. So 100 acres of land may be only appraised at, $15,000, where if it were appraised at market value, it might be $150,000. So it's valued a lot lower than what market land would be, regular vacant land would be.
So why are the farmers getting such a break?
Well, I believe the legislators created that in order to stop the urban creep from kicking farmers out of their ag land. So, you know, as the development moved out towards the farm ground, then they weren't being bought out or priced out by the market.
Okay. And I don't mean to be negative about farmers. I mean, good for the farmers that they're able to be able to do that. But at the same time, is that a real, I mean, does that correlate then to what the property's actual worth when they go to sell it?
The agricultural use value?
Yeah.
No, it's significantly lower than what the market is.
So just, again, for the sake of the conversation today, you might appraise a agricultural land at $1,000 an acre, where the market is selling it at $7,000 an acre? Is that what we're talking about?
Exactly that, yes.
But that's different than it is for, if Mr. McClure owns a warehouse in the middle of Topeka, he's getting appraised the full value for his commercial property, and he's have to pay taxes on it for the full value of that commercial property.
That's correct.
And if Mr. Rippon has a home in Topeka, he gets appraised the full value of that.
Yes, that is also correct.
Okay, just making sure.
Honestly, it's a statutory requirement. It's part of our tax scheme, so I'm following the rules there.
In commercial property, it's appraised, you said it's 28% of the total value?
Yes, total assessed value. When we go back and look at the appraised value, it's only 13%. So we have 16% of the total appraised value of the $18.2 billion. 16% of that is exempt. That disappears when we go to the assessed value side.
Okay. All right.
So we mailed valuation notices on March 1st, so most everybody should have them by now. We mailed out to about 67,000 parcels. About 85% of properties are going to be seeing some type of an increase in value. We did not mail notices to those properties that didn't change in appraised value. So if you didn't get a notice and you want one, you can go to our website, snco.us/AP. They are available there. You can call our taxpayer assistance line, 232-75-232-4461. Or you can stop by our office, we'll print you one, or you can send us an email to snappraiser@snco.us. You can find them there on our website anytime you want to. And you don't have to have that notice in order to appeal. So, the appeal options, you can appeal the valuation notice that we mailed March 1st, or you can appeal you can appeal the taxes through the payment under protest option after the tax bills are issued. You can do one or the other, you can't do both. So if you miss the appeal deadline, which is April 1st this year, then you can pay your taxes under protest if you still don't believe that the value we have in place is accurate. The valuation notice isn't needed to appeal. You can call our, at this level, a valuation notice isn't needed to appeal. You can call our phone line. It's open now. It's 232-4461 again. That line, we can answer questions, schedule appeals, or both. So if there are any questions at all about the appraised value, I welcome the call. I think it's a good idea to make that phone call. This chart is the appeal history going back to 2008. You can see this last 2 years, our appeal counts have spiked significantly. That would correspond with our value increases spiking the way they did. 2,313 appeals last year. we're normally hovering around that 800, 900 appeal mark. That purple line running through there is the percent change that had some type of change in value. I've included that to let people know it's not just a dead end trying to appeal. We consider all of the information, and a lot of the reasons for these changes are going back to my original slides where I talk about we have to assume that the interior is similar in quality and condition to the exterior. A lot of these changes during the appeal process would indicate that they brought in information to help tell us the condition of the home. And then last year the percent change dipped, and I think that was because there was just a lot of upset people about the value increases and the potential for a tax increase to go along with it.
So if I do my quick math, if you had 2,313 appeals and only 30% change, that means there was 1,619 unhappy people that saw no change in their value.
Well, so you would say that, but there are some people that canceled, dismissed after scheduling the appeal, and some people that do agree with the conclusion. So I don't know how many of those people were unhappy, but that many people didn't get a change at that informal appeal level.
Okay.
And then I think it's important to note also that our informal appeal level isn't the end. So once they appeal at the informal level, they don't like our decision, they can take that and appeal to the Board of Tax Appeals. There's a small claims division. It's very easy to maneuver. There's a person that's sitting there deciding the case where we'll go through our value conclusions, and the property owner can explain why they think we're wrong, and then that person will make the decision. And then you can go on to the full Board of Tax Appeals if you don't like that decision. So there are options beyond just our level. And this is the timeline of the property tax cycle. So our appraised values are as of January 1st. We send a notice out March 1st. The appeal deadline for this notice level is April 1st. Then we certify our values to the county clerk on June 1st, by June 1st. And the 2020, well actually that's the 2025 budgets will be determined in August. And levies are set November 1st. And then the first half taxes become due December 20th. Those first half taxes are for the 2025 budget, even though we're in the 2024 year. The value is as of January 1st, 2024 is what we're paying taxes for at the end of the year in December. And then the second half taxes will become due in May of 2025. There is some assistance out there for low-income seniors and disabled veterans. Homestead property tax is a refund up to $700. You have to be income less than $40,500 and 55 years or older. The SAFER property tax refund refunds 75% of property taxes paid for low-income seniors, 65 or older, less than $23,700 annually. And then this one was new for 2022, the seniors and disabled veterans. It refunds the amount of increase in tax. These are all income tax programs that come out that way. But I put the numbers up here for people to contact. There's a taxpayer assistance center with the Kansas Department of Revenue. But our county clerk also handles all of these calls and assists people filling out the forms, which may be their best option. Our county clerk runs a good office, and they're really good at helping people fill out these forms. Then lastly, our property information, most all of it's available on our website. General property data, aerial photography, zoning maps, property values. We also have building detail level information so people can verify that our information is accurate. Let us know if it's not. We also have our property comparables out there, including where they're located. And then the property tax information is also available on our website. Treasurer Ma provided this to go along with our website. Has a history of values, taxes. It also provides us with this very nice chart of where all of our money is going to each taxing district and what percentage. And I believe that's all I have, unless there's any questions.
Commissioner Rippon, do you have any questions?
No, but could you send me a copy of this PowerPoint presentation?
I sure will. And this PowerPoint presentation will also be available on our website too
Okay.
for
Very good.
access.
I just think there's some slides in here that'd be good for explaining where
Very
we
good,
are.
yes.
Steve, just a couple of questions. Start with commercial property. This weekend, I went through and was clicking on a lot of different commercial property, and I noticed that a lot of commercial property in Topeka had zero change. Is that some indicator of the market of commercial property in Shawnee County, that it's flat?
Our market for commercial property is generally flat to slightly increasing. It's going to depend on property types. Like our office market, just like the national market, is, I think, at a state of concern for a lot of people, but we're not seeing that market increase that much.
Okay, but I noticed that some of the smaller towns, Rossville, Silver Lake, Auburn, their commercial property seemed to uptick a little bit. Is there a difference between the city and the smaller communities?
Well, they'll have different areas, obviously, and different models to go off of, but generally it's based on the type of property. So it would kind of depend upon what kind of property types we're looking at.
Okay, and then the other thing that I noticed as it relates to residential property, like you said, 5%, 6% was about what I was seeing across the board with properties that I was looking at within Shawnee County, but it's also keep in mind, if you're talking about $250,000 property, a 5% increase is $12,500. So that still may seem like a pretty big jump for people if they see an increase of, $12,000, $15,000 to their property. So but on average, you're saying it's between that 5 to 7%?
Yeah, depending upon location in the county, I think our general trends were 2 to 8%, but not everyone's going to fall in that. And that's just if there's really been no changes to the property other than their general maintenance to keep it up.
Okay. Now, if a person saw a huge jump in their, let's say they just purchased a home, and they saw a huge jump in value, is that because of the price of the home sale, or is that, what would attribute that?
Well, it's a good question, and it's going to depend upon each situation. We don't just apply the sale price to the property, because one sale in and of itself does not constitute market value. That part's in the statute also. But there may be changes that occurred to that property that we weren't aware of prior to that sale. Like property owner goes in, renovates the house, and then sells it. That sale price is going to alert us that something has changed, and we'll review that data and then the value accordingly.
Okay. And if a property owner does get hit with a value change, the first step is to contact your office to ask for an appeal or a review?
They can call and ask questions. That's 785-232-4461 number. They can call and ask questions. We can go over the information with them. They can schedule an appeal, either one, or both. they can decide whether or not they want to appeal after discussing it with us.
Okay. And then going back to, you said that the property valuation department says that we're on the low end of accuracy?
No, we're at the high end of accuracy. We're at the low end of ratio. So the 90 to 110 is where you need to be in order to be in compliance. So we are at the low end of that ratio study. So that means our appraised values are almost 10% low from the median ratio of 1 to 100.
But don't you base that on January 1, so.
Right.
So you could have a appraisal, or I mean, the value going up throughout the year that you really can't account for then.
Right. And so even in that situation, when we trend our values up, we're still considerably low on our values. But the market appreciation through the year is what's creating that discrepancy there, most of it.
I want to talk about last year, just so that people kind of have an idea and understanding. Last year, we saw property values jump by 18 or 20% in some cases.
That's right.
What if you, as the county appraiser, said, I think this is too much of a jump for my county. I'm only going to increase property by 5%. What happens in that case? Steve Bauman says, I know that the market jumped 20%, but I'm only going to increase it 5%. What happens to Steve Bauman?
Well, I would love to be able to do that. Unfortunately, I can't because it's not following statute. It's not following the uniform standards of professional appraisal practice. And the property valuation division of the Department of Revenue would come down on me and probably ask you to replace me. So it would be illegal for me to do that and unethical.
Okay. So who ultimately determines what the valuation, I mean, is it the property valuation department that's directing the percent of increase, or is it your office that's directing the percent of increase, or is it the market?
It's the market. So we're only following what's occurring in the market. And I know people have said it would never happen, but if the market does go down, we will reflect that. And we've been watching for it. We expected it to drop last year, and it didn't. It continued to increase. And this year, even with the interest rates high, it still didn't drop. And I think that's a lot attributable to the supply problem.
I know that I talk with people, a lot of what they've expressed is fatigue in the increase. I mean, if they were selling their house, obviously that would be something they would appreciate if they were wanting to sell. But we've now gone on now for almost 6 years. I mean, as your slide a couple back went from a person's home being at, what, 150, and now it's 200, and so you might see a $50,000 increase.
Right. Yeah, our job's a lot easier when the market's flat. But it's not. But it is getting back to normal. You know, before all of this, with the COVID years, we had a normal market of 4 to 6%, and it was almost like clockwork. You could just count on it being 4 to 6%. But you know, we had a normal supply, interest rates were normal, everything was in balance, and that's where we were going. And you know, even back during the 2007, 8 market crunch that we had, you know, the coastal cities that were going up double-digit increases, sometimes 30% a year, they took a big dive when the market crashed. Topeka didn't really see that happen. It took a couple of years, and we finally went down 1% or 2. And that's, you know, that's not us telling you what the market's doing. That's the market telling us what it's doing. And so we just have to follow that and report it in our appraised values.
Okay.
A few years ago, we bought some software that it would notice change in the footprint from an aerial photo. Are we using that, or we had new photographs that would reflect those changes? Or?
We're not reusing that, but that did provide us with beneficial information to help assure accuracy. It also redirected some of our procedures because we noticed that there were some things that we were missing. So we haven't done it again, but Lee Allen in our GIS department has software as part of our programming that he is working on, and has provided some level of detail with that we still need to spend some time and work through. But it's coming, and so we'll be able to do that on an every 2-year basis now.
And I guess the last thing, again, just to reinforce, if your appraisal of the property is based on what the outside looks like, but you don't know what the inside, if a homeowner has had a catastrophe, a water pipe burst, destroying a percentage of the home, they should probably let you know that that their house has had this damage, and it's affected the value.
Absolutely, if it's still there as of January 1st. So, and, and we do get some calls about property being renovated, but our value didn't change or didn't change that much. And it's based on a January 1st valuation date. So, there's a house that a fire took place at the end of last year, and it's been fixed up in February this year. Well, they won't see that value increase until January the following year. So it's all based on what the home's condition is at the first of the year.
I know a lot of older homes, they may have had finished basements that, I think this is common, a finished basement that gets a water leak, and so people take it from being a finished basement to an unfinished basement, but your records would still reflect it as being a finished basement.
Correct. We need to know about that.
Okay.
So they can reach out to us, either send us an email to the SN appraiser at snco.us, or the phone call, or Google our address or our phone number. And however you want to try and get a hold of us, we're there.
No other questions?
Anything I'm missing out, Mr. Eckert? Okay. All right, and then I guess just again for the final, your office is not the one that's in charge of taxation.
That's correct. We don't do taxes. We can't even really discuss taxes because our appraised values are what we do. And we understand that there's a tax issue in some cases, but there's nothing we can do about the tax dollars. You're just talking about the appraised value of the home.
Okay.
The only thing I would add is that when we were talking about agricultural values, those values are not set by the county appraiser, they're set by PVD.
That's correct. So we get a list of values for every soil type for agricultural use property from the state. So.
Okay. I think that's all I have. Thank you, Steve.
Thank you.
Thank you.
Next up is the Health Department to talk about the aid to local grant application process and for fiscal year 2025.
All right, good morning, Commissioners. Teresa Fisher, Director of the Health Department. This year, my team and I, although we're a smaller team today, and I'll speak to that in just a moment, brought back our aid to local presentation. In years past, we've given a really high-level overview, but with the work sessions, this has enabled us to give you guys a more detailed look at these grants. By far and large, our aid to local grants are the majority of the grants that fund our program. So I do have one grant manager here today, Missy Middendorf, and she'll be presenting on hers. I'm going to be stepping in for both Craig Barnes and Carrie Dels. We had some unexpected absences today, so I'll do my best to get through those slides, not being the content expert that those two are. But we also have our financial staff, so Kathleen Burrows, who's our newest leadership team member, our Finance and Administrative Division Manager, who joined us last November, so excited to have her on board. And then Amanda Neosi, who is our accountant too, are here should you guys have specific financial questions. I do want to give a preface. I'm going to update a few of these slides. We tried to send an updated slide deck this morning and it did not come through, so I will call note to any of the differences in the amounts as we go slide to slide. So Again, this is based on the state fiscal year of '25, so these are grants that we're applying for that would start July 1 of this year and run through June 30 of next year. So we're applying for just a little over 1.4 million is what our total grant request will be. Just a little bit more than what we requested last year, but you can see what we actually received last year was substantially less, and that was pretty typical with our aid to local grants. All right, so I'll start in on some of Craig Barnes's areas. So childcare licensing, this particular grant, of course, childcare licensing is one of our regulatory programs. So these are the staff that go out and do all of the both home and child centers. They do summer day camps. They do the drop-in programs, after-school programs. So they're doing the initial visits, they're doing any complaint visits, and then their annual visits also. So currently we have about 309 licensed providers here in Shawnee County. Looks like last year we had about 335. So I know we're working hard with Child Care Aware of Northeast Kansas to continue to provide the orientations. We're still doing those free of charge, trying to get more providers in, or at least who's interested in possibly being a provider. So this is $1 amount that has changed. This dollar amount is staying the same. We received $167,171 last year. That is what we are allowed to request again this year. The group was told that it will need to stay flat funded. So our total program costs are definitely more, and you'll see that on another slide, that the grants in this particular program do not keep up with our salaries and benefits. This is a grant that's based on a formula, so we'll try to call out some of these that are, and this is one of those that is based on a formula. So you will see here specifically the different variables that go into that formula. And then there are some bonus funds available, and I believe we're able to get a few of those based on some of our surveyors that have longevity with us. We currently do not serve outside of Shawnee County. There's definitely been some conversations at the state level. They typically use the term regionalization more, and not just in this grant, but other grants looking at other smaller counties that are nearby that may not be able to offer specific services, or how we can best partner. But as of right now, this is not one of those programs that we've taken any further with that. Here's the slide you'll see where it really doesn't keep pace. I would say over the last 6 years here, it has not kept pace. And again, this will be over the past 4 years. It says 3, but it's 4 years here. It hasn't increased, so we are still at that same dollar amount. And so, of course, our salaries go up each year, and so this grant is one that definitely does not keep pace with that. I think I'll just stop and ask if there's questions on specific grants as we go through, because you're going to hear a lot of them. So are there grants on the child care licensing or questions on this grant?
I just had a question about the number of child care facilities we have. I know during COVID we lost a lot. Mm-hmm. Are you seeing a recovery there? Or? Yeah,
I think we're still down. Like I said, I think we're not back to where we were even last year yet. But I know they're doing hard work with Child Care Aware to recruit those providers and just again gain interest. Somebody who's even just thinking about it, we want them to get to an orientation so they can hear more about it. But I would say it's an ongoing effort that's still needed here in our community. I do not believe there are enough slots for the child care that we need.
So if I look at the slide you've got up right now, mm-hmm. for 4 years, you've had no increase to that grant.
Correct.
I thought that it was the governor's office and the state wanted a lot of emphasis placed in child care.
Correct, and I think that they do. It's not that I think that they don't, it's just the funding that's available. And typically on not only this grant, but other grants, you'll see the ask is more, there's more requests than what there is grant funding available. And so this will continue to be, and something that we look at, but this is one that I think our staff does an amazing job in this, and the applications that you'll see later this month are well written, but unfortunately this is one that's driven by a formula and then what the state has available. So not even as much by the formula.
Okay.
All right. The next one that falls under Craig is chronic disease risk reduction. So this is one that looks, these are evidence-based strategies that his team puts together that impact tobacco use, physical activity, and nutrition. This is another change. We're actually requesting more grant funds. This year we're requesting $112,350 in grant funds. So we have seen an increase, and you'll see that in the slides. There's a pretty sizable request that we'll be asking this year. Last year we received $63,826. And that total program cost is also off. I will get you guys an updated slide deck with these. So this is a competitive grant cycle throughout the state. Different entities apply for the chronic disease risk reduction. I can tell you that not a lot of local health departments do, so I'm always proud that we do the work. This is a rigorous grant, both the application piece and then carrying it out, the reporting piece. So there's a lot of local health departments that simply just don't have the bandwidth to do this and be able to carry it out. So we do have, you can apply for up to 5 activities, but the biggest push is the tobacco use prevention program. And yeah, I think I'll talk about it on the slide. So looking at the activities they have planned for this year, they have 3 grant activities planned. One is working on our tobacco treatment resources here in our community. Another is tobacco reduction and quitting during the perinatal period. So the grant will be working specifically with our maternal child health and our women, infants, and children program, and focusing on collaborating with those and the clients that overlap in those areas. And then the other activity will be focused on safe routes to school. This will be a partnership with the City of Topeka and USD 501, and they'll be looking at 3 different projects this year. So that's very exciting on those collaborations. This again is a chart of what we've seen over the last few years, and again we've since 2022 we've seen a steady increase. I think in 2022 we were still in COVID. We had some challenges being able to cover out this grant. I mentioned it's a rigorous grant, the activities, and so we have been able to of course onboard some new staff over the last few years that have really been able to put their best efforts forward in this grant. And as such, our grant funding has gone up, and we're hopeful that we'll see an increase again this year. With that, I'll ask if there's any questions on the chronic disease risk reduction grant.
I don't have any.
Okay, move right along here. So we have 2 public health emergency preparedness grants. The first one is the local. This dollar amount, again, I apologize, a little bit different. It's $110,191. And again, that was a request to stay level funded for this year. So that's the exact same amount that we received last year. This is also a funding formula based on population. So this is used here to, for our local participants. We have one particular staff member who is dedicated to the local FEP work, so making sure that not only our health department, but our community are ready to respond. We're, I know right now, going through our COOP plan or our continuity of operations plan, getting that updated and ready to roll again. Lots of different areas that he makes sure that we are ready to go in the event of an emergency. So that's largely what this grant covers, is his salary. He also coordinates what they call the ESF 8 number 8 annex, which works with our local hospitals for that particular annex. And I'm sorry, I can't speak to that annex today. I don't have that in my notes, but that's specifically what he is working for with our local hospitals and medical providers. And then we'll see here again, this one, although there's been just a slight increase this past year, it's been pretty solid, I would say, since 2020, as far as the funding of what we've had. Questions on local FEP? Okay. The last one of Craig's grants that he oversees is the regional FEP. So we do serve as a fiscal agent for these funds. So largely, this helps, this grant award also helps cover that particular staff member. So again, we have another public health emergency preparedness staff member who covers the regional aspect. The request is Also staying flat funded, so it's $37,730. That's what we received this year, and we were requested to keep that the same base amount. So you'll see there are 8 counties that make up this Northeast Corner Regional Initiative. And Sky Reed is the staff member who oversees that. She works with all of these departments or these counties and their emergency preparedness departments, if they should have one, or if not, in some of these cases, they're a smaller staff, to make sure that they also have their plans updated, that they carry out any exercises, things that they need to work through. She also serves as a resource for their grant reporting applications and things of that sort. And you'll see this here over the last 6 years. Again, this one's since 2020 been pretty similar. We see a little up and down, but overall it's been pretty steady, I would say. Questions on the regional FEP? Okay. I'm going to turn it over. Oh, no, I'm not. I'm going to keep going. Missy, you're going to, hang on, you'll finish the show, I guess. So, all right. So again, sorry, I'm having to pinch hit for Carrie Dels, who could not join us today. So Carrie oversees several grants also. So family planning, of course, this is one of our newest. We are just coming up on 2 years here in our ribbon cutting was 2 years ago this April, if you remember that very windy day that we cut the ribbon. But so very excited that this has been here in our community now. So KDHE is who, of course, administers this grant. They are a subrecipient through the federal government. So there are 2 priorities. Priorities are given to public entities, meaning state, county, and local health departments and health clinics. And then the remaining funds are distributed to non-public entities. So this is definitely a grant. I can tell you that over the last year we learned there's definitely more grant requests than there is funding for this. So, but this program is all about serving individuals that are in their childbearing age, both men and women. Planning the number and spacing of children. We're working towards positive birth outcomes and then improved health for both our women and our infants that we see. So we refer to this as Title 10. So there's some requirements here. So a few things that we have to have include our advisory committee. So we've got anywhere between 5 and 9 individuals that sit on that advisory committee. They review and approve the information and literature that's used with our clients and education materials, provide any guidance if we wanted to develop something new with that and provide input. We provide community education programs, so anybody that wants to know more about family planning, we have staff that go out and do that. Our pharmaceuticals are in compliance with the Office of Pharmacy Affairs and Guidelines, so we purchase them through what's known as OPA, or the 340B drug pricing program. So Carrie and I oversee that. Excuse me. And then we also have to establish a schedule of fees and discounts for any of our clients that come through, and that's based on the federal poverty guidelines and the Title 10 requirements. Here you'll see, again, this is where definitely this grant does not keep pace with what we're needing in regards to that. We do have a mid-level provider that works in the program. This past year we changed her to intermittent status, which has allowed us to free up some more of her grant salaries and really be able to meet the needs of the clients when they're scheduling their appointments. It was determined to be a better use of her time. And then of course nursing staff that do that. We did have our first site visit. I would throw in for the family planning, and I haven't yet got to send that to you, but we overall had a great site visit. This was our first one from the state, and they were pleased with the program that we're delivering here in Shawnee County. Questions on family planning? State formula, so this is funds that are based on our population and our tax allocation. So this is a line item in the legislative budget each year. So right now, our allocated amount for this coming year is the $285,603. It is up. Last year we received $272,293. There is a request at the legislature. I'm not sure if it will pass through, but we're always optimistic that we might see a little more than that. Largely, we use our state formula to cover our clinical services division, or a portion of it, I should say. It doesn't cover all of it. That's the area that has the smallest amount of grants that cover those salaries for both our staff and our supervisors. So we largely use the state formula for that. Questions on state formula?
No.
All right. Carrie also oversees the immunization action plan. This also is an allocated amount, so this is the same amount as last year, the $33,438. There's some points there that tells you how that amount is figured. So you do have to be enrolled in the Vaccines for Children or the VFC program in order to be eligible for this, and of course we are. And you'll see there that we provided 3,454 VFC doses to just over 1,100 children here in 2023. So we're definitely being able to see those children and get them vaccinated for these vaccine preventable diseases. Okay, any questions on the IAP?
No.
All right, now I'm going to turn it over to Missy to talk about her.
All right, good morning, Commissioners. Missy Middendorf with the Family Health Division Manager. So our maternal child health is requesting, again, this is not the accurate number because we are requesting more this year due to we'd like to add another social work position. We have 2 social workers that do home visitation and they're constantly full on caseload. And that is one area in our county that we noticed we have a decrease in home visitation that has home social work that does it. And then also a lot of our home visitation here in our county requires certain parameters, like you have to be enrolled at a certain time, it has to be your first child, or things like that. And so they are able to take anybody in Shawnee County. So that is our request to up our amount this year. Our total program cost you see there, and we also require the 40% match of the general operating funds. And these programs for maternal child health include the first steps, which is the social work portion of it that does home visitation. Our baby basics, which is our prenatal education classes. Newborn postpartum home visits, that's what our RNs do. And then our fetal infant mortality review program are all out of our maternal child health division. And then currently for the funding out of KDHE, it's based on a formula grant funding. So we pretty much have been getting the same amount for year after year, which you'll see in our next slide. But you can see that they base it off of the number of children in your county, of ages 0 to 22, females, and under the children under the age of 18 living in poverty. So those are a lot of things that we just don't have control over. And so you can see in our funding for the last 6 years, it has been the same amount. And then last year, they KDHE received a lump of money, sum of money to give out to people that are doing home visiting services. So a lot of counties, they do maternal child health, but they might do most of their visits in the office, where we go out into the home. So we did get an additional $10,000 for that last year. And then we requested this year, obviously we're still doing home visitation, and they did tell us that they're lumping everything back together again, that was just a one-time thing. So I don't know what our dollar amount will look like for the award, but that's why it did go up last year. And then just as our staff, we have myself, I am in this grant, as I'm also in a WIC grant and also the Early Childhood Block Grant. We have 1 team leader that's full-time. We have 2 full-time social workers, and then we have 1 filled of our RN and 1 vacant RN right now. And then we also pay a portion of an office assistant and a Spanish interpreter. And then you can see some of our numbers from last year, our total client encounters, that actually doubled because we actually have staff. So that really makes your numbers go up. But unfortunately, this grant's not looking at numbers, but we still like to say that what we're doing. And then our Baby Basics participants, that we had 52 that enrolled and completed 4 more classes is what they require. It's a 6-class program. And then we reviewed 22 of our femur cases in our case review team. And then we do numerous outreach activities. We did our first year of car seat check lanes, so we host those 4 times a year on Saturday mornings. And we also had 2 staff members become car seat technicians, so they went to the 3-day training, and so now they can help with these. And These are put on by Safe Kids, Shawnee County. And then we also do the community baby shower and various other events related to families that we serve. Any questions about our maternal child health grant?
I don't think so. Thank you, Miss.
All right, so this is just a look at the actual awards comparison over the last year and what we requested. So things I want to note is that we continually search for grants to help fill some of our gaps. We will be focusing on our new grant software, the eCivis, that we've all been trained on, all of the division managers and myself. And I know we've got another training coming up, but hoping that we'll be able to see some grants that will help fill some of these gaps that will align with the work we're already doing. I do want to note the last 3 columns you'll see there are 3 COVID grants, and those grants will all roll off this year as of the end of July. So those will be done, and we don't have any more of those. And then I forgot to call out, thanks Missy for mentioning your the match required. So the family planning grant and the chronic disease risk reduction do also have required matches. While Missy's is 40%, these two are 25% required match. So and then this grant packet will actually be on the BCC later this month. It won't be on Thursday. We're still fine tuning some of the application piece. So they extended the deadline back. It's typically due around March 15th, and this year it's not due till April 1st. So we're still finishing up some of our narratives and reviewing those. So you will see how much work has gone into these from all of these individuals. Missy and Craig and Carrie are largely the grant writers along with some of their other staff. And so even though the funding hasn't changed a lot, I'm still really proud of the grant applications that they submit and the work they do year after year. So with that, questions in general about the Aid to Local grant package?
No questions.
I'd like to see it go up, but I understand that those are things outside of our control. So I appreciate all the work that you guys do.
Yeah, thank you.
Thank you.
Thank you very much.
Okay, that brings us to public comment. Is there any member of the public that wishes to address the commission?
May I approach the bench?
Well,
It's for you.
you have 2 copies? You have copies?
I'll email you. Oh, look up. Wasn't ignoring you. Henry McClure. As a father of a daughter and a single parent, my daughter's constantly reminding me, Dad, it's all in the delivery. So I approach today as a taxpayer that, and I've come forward in the past talking about my resentments to where the economic development money's going to. That I don't feel that it's fair that a bloated overhead of 67% of the grant, if any of these ladies would have come up and said, we've got a grant and the overhead's 67%, you'd spin their hat, tell them no thank you. It wouldn't be fair. But what's really interesting today, to dovetail while I'm here today, is to also talk about the grants that go to PICA administers or doles out. And then it comes down to, so we're first all taxpayers, and then second, I look at it as the world through the lens of a real estate developer and a broker. Then you really need to look at things through the lens of an officer of the court. You know, is what you're doing legal? Is it actually legal to do what we're doing and the way we're doing it? So I ask you and your counselor, as an officer of the courts, to review the interlocal agreement and point out how almost $1 million over the last couple of years has been doled out by an entity that's supposed to be doing economic development. So if Molly and Matt want to dole out our taxpayer dollars through grants, and plus I want to follow the money. I'm, through this, I'm making a Cora request and a request of my county commissioner. I want to see where all that money went. I want, number one, I don't think it was legal to give it to them, but who got the funds? Where did that money go? Let's all, you know, a lot in life is interesting when you follow the money. And so I'm asking you as an officer of the court and my county commissioner and the chairperson of JEDO to help me investigate this. Because a lot of people asking me about this. They said, you know, you've brought up some really decent points. And I've been involved with this thing. And the reason that gets me here, the main resentment was I was one of the guys that went out and was a cheerleader to get the sales tax in place when we had to renew the quarter-cent sales tax. And others from the Greater Topeka Chamber of Commerce have been really big cheerleaders of projects that I've done similar, that I've never gotten the same effect. I've never gotten that same umph. And over the years and the 11 different communities that I've lived in, I've never felt that our local chamber's been, it's been more pay to play than any of the other communities I've ever worked in. And as I really analyze this, it's like, let's use a baseball analogy. That the Greater Topeka Chamber of Commerce is the pro team, and they use Go Topeka as the farm club. You ought to look on some of the staff. They've got one lady that made a presentation that she went and visited some schools. It's not right to the level of the gardens. You know, when we're going to plant gardens as economic development, but it's right there. They're equal. And if you look at this lady's resume online, she doesn't have any qualifications. So why is she going to high schools, making presentations, and we're saying that's economic development, and paying her salary, when not one, and I'm going to go back, it probably all started with Heritage Tractor. I brought Heritage Tractor to town, and I needed to get a sewer line put in to develop that, and it was, everybody always fights everything. We're not going to do that sewer line. It's, he used the term earlier, Steve did a good job, but you just get numb to the process, and you've been told no so many times. So let's put your officer of the court hat on and show me and tell me, I know this isn't public discussion, but we should have a discussion as a citizen and my leader in the community as my county commissioner, and plus the guy that shepherds now the $5 million. You tell me how it works to have 67% of the grant go to overhead, and tell me how it fits in the interlocal agreement that group is even doling out grants when a real estate guy is told no at every turn. It never qualifies. And it really will come down to, actually, who do you have to know to get a grant to get help for actual economic development? And I feel like it's the difference between, if you believe in evolution, it's like chimps and humans. And I'm still the monkey's uncle out here trying to get deals done. And the humans aren't helping me. I should have stuck with the baseball analogy. But I appreciate your time. Counselor, I've asked you officially, hopefully it's a Cora request if it has to be. But thank you for your time and the opportunity to speak. Appreciate it. Have a good day.
Any other public comment?
Got here.
I've been trying to follow up on
Oh,
that.
If you could state your name.
My name is Franklin D.W. Williams, and the handout that I gave you shows what seemed to be, I had my daughter, who has a master's in math, correct the numbers on the right-hand side of this document I provided you. On the left-hand side is what's gone into our economy and what's been in commerce. On the right-hand side is what my daughter corrected for us, because the numbers that will remain in your system were not accurate, or were not set out accurately. And what I did this for is because if the left-hand side has been in our economy and in commerce, it's been less than half of what should have been. And this is a plus. The emails that I've been sending you has been a plus, 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 all the way through. I've been working with out-of-state law firms to make sure that I was accurate in what I was trying to offer you. And all this is plus for the system. And I've never heard any of this in the media or any place that's been a comment. And I've taken this back as far as we've kept records. And I have emails that I didn't provide you, of course, that's been coming from USDA. The stat guys have been sending me the figures. And I've gone back, and the one stat guy, he was deputy director when we started, now he's director. He tells me that we've gone back now as far as there is records. And so we'd probably have to go to the newspapers and find out what the newspapers were printing on the issues previous to keeping records. And all this is a positive for the system to function under. And I know when you show that to somebody, it looks so serious that they just don't even want to have to imagine understanding it totally. But it's all a plus, plus, plus. It's a plus for the system. It's a plus for everybody. It's a plus for the nation, the states, and the victims, of which some of you have to be victims, I would think. And I imagine you'd have to go back and look at the emails that I've sent you, because they're so immense that I've tried to get them from everywhere. I've gotten them from the National Archives. Finally, I got HR 23 finally sent to me certified. And very difficult, because you can go back and look and see how long I've struggled to get it out of the National Archives, because they knew they didn't want us to have them, I'm sure. But I'll stand for any questions, and if you need more, I'll share with you more, because one senior supervisor for the FBI told me that I needed to file an action. If I'd file an action, our system would just failed everybody. Our system is just broke. And it isn't your fault or mine unless it's because we didn't speak up soon enough or wasn't aware of it soon enough.
Good.
If you have any questions, I'm here to answer them as best I can. And if you need more information, just search the emails and find out. If I've not given it to you, I'll sure make every effort to provide it.
Okay, thank you.
Thank you.
Thank you very much. Any other public comment? Any administrative communications?
Good morning again, Commissioners. Teresa Fisher, Director of the Health Department. I am excited to announce that today the 2024 Shawnee County Community Health Needs Assessment is officially kicking off. So I want to make sure I call out the leadership of the steering committee for this work. That includes Stormontville Health, the Vallejo Behavioral Health Center, Family Service and Guidance Center, University of Kansas St. Francis, Grace Med, Live Well Shawnee County, United Way of Kaw Valley, and the Health Department. These partners have come together. Of course, we do the Community Health Needs Assessment every 3 years, and it is time to do it once again. The formal survey, of course, opens today. It will run through April 30th. There'll be questions that are focused on access to care, preventative care, health and social concerns, income, pregnancy, postpartum, and participant demographics. There will also be numerous roundtables that will be hosted, so we encourage the public to stay tuned for that and to attend any and all of those that you're able to. There will also be a town hall community meeting that will be held on May 15th to discuss the findings of the Community Health Needs Assessment, and we'll also look at the county health rankings that will be coming out about that time also. And then lastly, today is the actual kickoff meeting. It is from 2 to 3 p.m. today at the Topeka Shawnee County Public Library Auditorium. So we encourage anyone to attend that. And again, you've got an opportunity to get your voice heard in a variety of ways, and we want as many people in the community to do that.
Okay, thank you.
Morning, Commissioners. Nelson Castile, Emergency Management. 2 items here. First, we would like to thank Washburn University, specifically Washburn Police Chief Chris Enos and their Safety Director Chris Herrera, who provided us a space last Monday to hold the Storm Spotter Talks. They were very well attended, of 93 people this year. And we also thank the Washburn Memorial Union staff for helping us with some technology and some additional chairs. Number 2, you might have noticed that we got some very welcome rain out there over the last couple of days. We would ask that you please coordinate on a regular basis with your fire authority having jurisdiction if you're going to burn anything. There is still a lot of fuel out there. The green is very deceiving when you look at it. There's a lot of stuff that could burn, so be sure that you're communicating with them and then practicing any of the fire safety recommendations that they pass on to you. So other than that, it looks like it's going to be a great week to be outside.
Thank you, Nelson. Commissioner Rippon, anything?
I don't have anything.
Nor do I. So we are adjourned.